Hi, I'm Dr. Mangesh Kamath. I'm a senior consultant medical oncologist, hemato-oncologist, and bone marrow transplant physician. Through this video, I want to discuss a very uncomfortable situation that an oncologist faces during his or her clinical practice. That is, how to deal with the patient when the cancer treatment given by us does not turn out to be successful. That means the cancer spreads or progresses despite the best of our efforts. Now, I want to touch upon this topic because it is a very uncomfortable situation for both the patient and the doctor. Remember, every doctor prides himself or herself for having given the best treatment to his or her patient. As an oncologist, I would love to have all my patients cured of cancer and all of my patients who are coming to me with the advanced stage being controlled forever. But we all know that it is difficult to have 100% success rate as an oncologist. If that was the case, then cancer wouldn't be as dreaded a disease as it is. Just like many other things in life, including machines, you cannot have 100% guarantee towards success. It is a difficult thing. Life is unpredictable. So are outcomes with cancer treatment. But just like a soldier would be positive at all times, a doctor has to stay positive at all times. An oncologist definitely has to stay positive at all times. So when we face a cancer patient who, despite our best efforts, has had cancer recurrence or the cancer has progressed, we definitely feel sad. Believe me, I have had relatives who are cancer patients. While I am elated when they are cured of their cancers, I am also disappointed. I carry the disappointment to my home when I go back from work, if when I have dealt with a patient who has had his cancer progressed. But at the same time, we have to understand that life is life. We are all one day or the other supposed to leave this earth. We have to be spiritual in our approach. So I tell my cancer patients that yes, unfortunately, despite your best efforts, cancer has come back. It is unfortunate. It is known in literature also that cancer has come back, but I am still with you. I hope you are still with me because we are in this journey together. Cancer sometimes is a very frustrating disease to manage. I have had patients who have come to me with the earliest stage of cancer but have had recurrences and progressed. And I've also had patients who have come to me with stage 4 cancer, with cancer having cured. How do we explain this but in a spiritual way? It's all in destiny, is what I would suppose, but it's difficult to explain destiny, luck, and God's design to a cancer patient who is already feeling bad that the cancer has come back, despite them having spent lakhs of rupees, despite them having spent hours and hours on their treatment, despite them having traveled all the way, and despite them having gone to the hospital multiple number of times. But that is how life is. There are so many things that we do, we may not get the best results for. But now on, I will tell you what we should do if the cancer comes back or progresses. The first thing is stay tight. Just like we have to accept failures, we have to accept failures of treatment. I, as an oncologist, have taken it in my stride that despite my best of efforts, sometimes the cancer can come back. But I am still with you. I will make sure that we use the next best level of treatment or strategy to make sure that we can fight the cancer together. Many a times, patients, when the disease comes back, lose faith in their oncologists. They say, maybe I was not given the best treatment. Maybe I was not taken care of well. Maybe I should see another oncologist. Maybe I should take a second opinion. Well, it is possible that a second opinion can give you a different perspective, but make sure to discuss with your oncologist, because remember, just like you are feeling disappointed, the oncologist who has treated you also will be disappointed. So make sure that you discuss that, doctor, can I take another opinion? Can we try something else? Don't think that the oncologist is not your family physician. Once you start your journey for cancer treatment, your oncologist is like your family physician, except that he's subspecialized in oncology, but he cares for you. He wants to make sure that you have the best quality of life and the most quantity of life. Please discuss, sit down, try to understand what can be done best. We can't turn back time, but we definitely can try our best in the future. We should sit down and see. Ask your oncologist for all the options that are available, the best, the worst, the most affordable, the costliest. Are there some treatments in the research pipeline? Are there something that they can try? Do you think that some special diet is there? Do you think that there are some special strategies that are there? Your oncologist will definitely tell you all. We are all well read and knowledgeable enough to guide you at every stage of your cancer treatment journey. But please make sure you discuss. Remember, communication is very important wherever you take treatment, with whomever you take treatment. Make sure that you discuss. Discussion is the only way that you will be able to have a lot of empathy from your oncologist. Make sure you have a lot of questions ready so that all the answers can be provided. If you are suffering from anxiety, stress, please let your oncologist know, because the oncologist will definitely make sure that these things are addressed. We can't win over death. At least for now, we can't. But let us make sure that till the time we live, let us have a very good quality of life. And every oncologist should be able to provide you a good quality of life for the quantity of life that you have been blessed with. Thank you very much.